If you want to become a father, according to WHO, you should have minimum of 15 million sperm each time you release. And the amount of good ones in this 15 million should be around 40 to 45%. The moving one that can actually travel the journey between the vagina of the woman to the ovary where the eggs are being released, they must not be less than 30 to 35% of the 15 million. With the numbers of men with increasing sperm quality going down, the number of men that come to the clinic with poor sperm quality is running high. For economic stress, metabolic stress, oxidative stress, we don't rest. We don't go on holiday in Africa. You don't have 10% of people in Nigeria that go on holiday annually. We are working. And the next thing you see a man that wants to go on holiday, he's going with his girlfriend. And he says he's going on holiday to rest. Are you stressing yourself more or you are resting? So these are the challenges that are compromising the quality of the sperm. So if the sperm is good enough or is borderline and the man produces adequate volume, we are going for conventional IVF. But where the sperm fall below 10, it fall below 5, we are going to the senior brother, the uncle of IVF, ICSI. We're going to get there one day. Yes. In one of our episodes. Intracytoplasmic sperm injection. Yeah. That treatment option established that no matter how bad your sperm is, you have the chance of becoming father of as many children as you desire to be. Normally, the woman produces one egg, occasionally two, once in a month. But this one egg or two eggs are not enough to get her pregnant in assisted reproductive technology that we call the IVF. She goes through some medications and injections on a daily basis with recurrent ultrasound monitoring, which tell us how she's responding to the medication, wherein we know either to step up her medication or to maintain and sustain the dosage she's on or to reduce. The sperm of the man is purified, removing the non-sperm constituent from the ejaculate. This pure sperm is assessed again, and you're sure that this volume, this count, is good enough for fertilization of the egg from the woman. And exactly 14 days after we put the embryos into the prepared uterus of the woman, we are collecting the woman's blood to check for pregnancy or not. And there and then, hallelujah! And somebody, and you see the couple, some of them break tears. Dog, they will hold you like a lion is holding, they will hold you so firm. Come to me.
You are welcome to another edition of Omega Fertility Podcast with Dr. Abraham Fasasi. In the last episode, we talked about general infertility and the challenges thereof. But today, we are going into IVF proper, in vitro fertilization. If you missed on the last episode, you can watch on all our social media platforms and you can subscribe to our YouTube channel, Omega Golden Fertility, and you'll be glad you did. In this new episode, we are talking about IVF as we have announced. My name remains Dayo Fowe, and here with me again in this episode is Dr. Abraham Fasasi. Doctor, you are welcome.
Good afternoon.
I must always say it. You are looking good. Even your smiles are infectious.
You know, it's so good to be here again and having the opportunity to speak with the world at large and our viewers from across the globe. I want to talk about IVF.
Yeah, from the last episode, I was surprised. Immediately we received calls and messages that this was a great one. How did you do it, doctor?
You see, it's a day in, day out thing. It has become a part of you. I mean, if you do something 5-10 times in a week, and you've been on that for 20, 21, 22 years, definitely it has become part of you. You sleep and wake up with it.
One of the comments even read that you made the whole thing very simple. Is it that simple?
Really and truly, the way they put it
a professional doesn't sweat at his duty.
Dr. Abraham Fasasi, I agree with you. Now, today, let us go into IVF. Doctor, what is IVF? It's a big acronym.
It's a big acronym, and it's an acronym that resonates across every corner of the world. You know, maybe in modern day, a few countries are not aware, or they don't know so much about IVF. But there's no country where you don't have an IVF center right now. You understand me? And because the challenge of delayed conception, childlessness is not limited to the black people alone.
Okay.
It's actually a technology of the white people. It was adopted to Africa. And if you count 1, 2, 3, we have millions of children already too in Africa from IVF treatment. So in one word, like I said the last episode, what do we call it? IVF. It is in vitro fertilization. That is the fusion of the male and female gametes, the reproductive seed of the man and the reproductive seed of the female coming together outside the body. That's what we call IVF.
Okay.
In simple words.
Doctor, you still need to break it down. You will take the female gamete, you will take the male gamete, and what will you do? You will fuse them together. Where?
That's why we call them the specialists.
Okay.
You see, it's done in the lab, really and truly. But it's a specialized high-tech laboratory.
Okay.
All right, where you have professionals who have been trained into all this. So when we talk about the female gamete, we are talking about the egg. You all buy egg and fry egg at home.
Okay.
The woman produces egg, even though she doesn't lay it like the chicken on you see.
Doctor, yes.
Now you are getting it now. Women knows when they are ovulating. Most women don't miss it. They know when they are ovulating. That egg, we don't allow them to ovulate into their body. We bring it outside the body.
Okay.
Through ultrasound. The men, we know what a man.
Doctor, please, before you go ahead, how do you bring an egg from the woman? You cut them open?
You want to act like the layman out there. In IVF,
Yes.
when you talk about egg collection, nobody's cutting any woman up. You use ultrasound guided needle through the vagina of the woman. As a matter of fact, if the hair collection is done now, it practically will not take more than 15-20 minutes. Maximum 30 minutes, you are out. And the same woman, depending on the social life choices they have been having before coming to the clinic, in the space of 20 minutes, 1 hour, they are awake and they're their way home.
Okay.
We only advise they don't drive themselves home. They get somebody to drive them, or the popular taxi, Uber, or their couple, their husband rather, to drive them home.
Okay.
So it's not something that keeps you in the hospital. Somebody, your family and friend are coming to check you. No. Under 30 minutes, the whole egg collection process is completed. You are walking on your feet and you are going no more than 2 hours. And you can carry on with other activities of the day. Really and truly.
Doctor, I know you still take us through this process, because how can I just walk into a clinic and you say you collect my egg just like that?
Before the point, there are about 9 phases of intervention before in IVF, as it is. The first thing is the couple getting to know about us.
Okay.
The couple coming to us to see us for the first time. We're having consultation down. After the consultation, you have diagnostic tests run, advanced diagnostic tests, other than the usual you've done from one lab to the other, from one hospital to the other. There's a reason they are called specialists. There's a reason they are called subspecialists. So these tests, some of them like what you've been through before, some of them is what you've been through before, but in further details.
Yes.
That's what we call it advanced practice. And you get the interpretation of this test discussed with the couple or the partner. Once these discussions are held, then we know where the challenge lies. Be it the man or the female or the two of them together.
Okay.
Is this something that can be addressed instantaneously, or it will take a longer time to get over it? We know. In that wise, the treatment pattern, the treatment protocol is clear before us. And the next thing, once the patient or the partners are ready, we are equally ready. And then we start the treatment based on findings of the diagnostic results.
So in other words, when couple present themselves in your clinic, the first thing they go through is that consultation.
Oh, sure.
After that consultation, you do diagnostic testing.
Yeah.
Yes.
And review.
And review of the results.
Yeah.
That's when we will know where the challenges are.
At that point in time, you are able to illuminate their past.
Okay.
What they knew, they didn't know so much. What they missed out become clearer to them. And that way they can ask a number of questions.
Okay.
When they ask their questions, you are able to allay their fear. You are able to demystify the complex area of the whole thing.
Okay.
And then the fertility journey become clearer to them.
Then what are the other steps?
So once the diagnostic tests are done, the results are out, and the review is done, the next thing is to get the eggs from the woman. How do you get the egg from the woman? Normally, the woman produces one egg, occasionally two, once in a month. But this one egg or two eggs are not enough to get her pregnant in assisted reproductive technology that we call the IVF. All right? You get her to produce 10, 15, 20.
Doctor, how do you do that?
She goes through some medications and injections on a daily basis with recurrent ultrasound monitoring, which tell us how she's responding to the medication, wherein we know either to step up her medication or to maintain and sustain the dosage she's on, or to reduce, so we can get very good quality and mature eggs from her. While the ovaries are being fueled and fertilized in that manner, the uterus of the woman is also being prepared to become receptive. Because you're not just raising the eggs, you're raising the eggs to meet with another seed of life from the male partner, which is the sperm. The byproduct of the two of them, the complex of the egg and the sperm, is what we call the embryo. These embryos will be transferred with a rubber catheter without cutting the woman open, without blood, anything, through this vagina, through the cervix, into the center of the womb of that woman, and you put it there. At that point, the limit of human effort has been exhausted. You're going to commit the couple onto the hands of the Almighty. And while they take precautions as to their do's and their don'ts, timeliness of their medication, altered lifestyle, because this modern age of what a woman can do better. That is not the episode. Long distance journey and all that, no.
So, Doc, what we are saying is that the female will be given drugs,
injections
and drugs to make them produce more than that one egg you are talking about. After the production of that more than one egg, because you said in IVF you need more eggs to play with.
Yes.
So you give drugs to the female couple, to the female partner.
Yeah.
Do you give drugs to the male partner to produce?
Yes, men sometimes do need drugs. Like I said earlier on, during the diagnostic workup, the review of the diagnostics will tell us, does the man meet the criteria set up by WHO for men who want to become fathers? Do you get it now? If you want to become a father according to WHO, you should have minimum of 15 million sperm each time you release. And the amount of good ones in this 15 million should be around 40 to 45%. The moving one that can actually travel the journey between the vagina of the woman to the ovary where the eggs are being released, they must not be less than 30 to 35% of your 15 million. So when we look at this sperm report, we realize that the man actually have a 15 million. But the number of good ones is less than 40%. The number of motile ones is 5%. Or he has 80 million. The motile ones is 10%. But the good ones is 60%. If you are good and you are not motile, of what benefit? What is the benefit of a BMW X7 that has no fuel in it and there's no fuel anywhere around? It's as good as nothing. A bicycle owner will run faster. So where we look at this review, like I said, That is where the idea of medication for men comes on. It is informed by the report. And let me be honest with you, like I said in the past episode, with the numbers of men with increasing sperm quality going down, the number of men that come to the clinic with poor sperm quality is running high. For economic stress, metabolic stress, oxidative stress, we don't rest. We don't go on holiday in Africa. You don't have 10% of people in Nigeria that go on holiday annually. We are working. And the next thing you see a man that wants to go on holiday, he's going with his girlfriend. And he says he's going on holiday to rest. Are you stressing yourself more or you are resting? So these are the challenges that compromises the quality of the sperm. Some are natural. Some people are born with sperm defects. Doc, I don't understand that. We have people, if you check back in the days, our mothers, once a child is born,
Yes.
they check the testicles.
Okay.
They see the penis. They will check the balls. There are two small balls in the scrotum.
Yes.
Our parents will check. Not all of us had that privilege to have the two balls in there. Some have one. Some they don't have. It didn't descend and they didn't discover early enough. Surgery can replace it, can correct it and bring it down. You understand me? Some pick up infection along the line during their young adult ages. And invariably, the infections were not properly treated. It destroyed the testicles. Varicose vein is another problem. The man is normally producing sperm, but the sperm turned sour. The number goes down, or there's nothing at all. So when we see all this in the lab, we realize the challenge and we let the expert know what is the next thing to do. So they place such people on medication. So the same way the women take drugs and injections, the men too are liable to have sex depending on the result of the sperm analysis.
Doctor, you are saying something about what WHO standard.
Yeah.
What is low sperm count, doctor?
You know, we have so many medical centers out there selling this, so everybody is singing low sperm count.
Yes, doctor.
But at this point now, I think we just need to break it open.
Yeah.
WHO, the World Health Organization, for a man that wants to be a father, you should have 15 million sperm density. The number of motile ones in there should be 35 to 40 and above. The number of good sperm in this 15 million should be 40% and above. When any of this parameter is lower than what WHO has recommended, either in number, either in volume, either in the number of good ones, either in the number of motile ones, if you fall short of any of that, that is low sperm count. It is not the usual watching sperm. My sperm is very thick, I'm a strong man. Forget it. You are just discharging starch. Not what we need.
Okay, doctor, you have mentioned something too that I hear often.
What is that?
What is watery sperm?
Take it from me, there's nothing like watery sperm.
Are you kidding?
I'm telling you, there's nothing like watery sperm. We all have varying consistencies of sperm. Some people release sperm and it's like phlegm. It sticks to the wall, it doesn't move. Such a person among the laymen, you won't say, sperm is strong. Oh, kisibe, according to the Yoruba, the Western Nigeria. But that is nonsense. You are the worst among the culprits of men. A typical sperm comes in a coagulum, like atramu, like a custard mix. All right? And in a space of 20-30 minutes to 1 hour, it should loosen up and be free, like saliva. So, but when your sperm doesn't lose up like that, it's a problem. The most important thing is the constituent of the ejaculate from the woman. Your sperm can come out in form of saliva from the beginning. What is inside? That's what we're interested in. Your own can be so thick, like custard. What do we have inside? The people that have very thick sperm released, they won't think they are healthy. It's not healthy. What is the beauty of a Land Cruiser, brand new, full tank, brand new tire, brand new engine, brand new gear, but there's a chain tied to the back axle and it's tied to a building? No matter how brand new it is, that Land Cruiser cannot pull a house from one spot. It will burn the engine on one spot. So that is the simple analogy for men with very thick sperm. They won't dissolve. They won't loosen up for the real sperm cell to move and do the magic work. So the sperm will struggle on one spot and die.
You can see how Dr. Abraham Fasasi is breaking this thing down. You can still subscribe to our YouTube channel, Omega Golden Fertility. Doctor, let's continue. We are at the process of you talking about the process of IVF in your own clinic.
Yeah.
And we stopped at the usage of drugs
For men.
for the men.
Yeah.
So what are the other steps after this?
So if we establish the fecundity of the man,
Yes.
by virtue of the quality of the sperm he has,
Yeah.
and we believe that this sperm from this man is good enough to raise the hope of 9 months journey, then we are home and dry. Because the sperm of the man is pivotal in the journey of conception in vitro. The sperm dictates either we're doing the conventional IVF or its variants. If the sperm is so good and the eggs are out, we do the conventional IVF and we're following up for the next 5 days.
Doctor, what is conventional IVF? Sorry to butt in. Conventional IVF.
Conventional IVF is the man has good or borderline sperm.
Yes.
The sperm is not low, but it's not so good, or it's good. Those are the people that can do the conventional IVF. WHO said you should have 15 million.
Yes.
Such a man that has 12, 13 million, they will still do IVF. Because what they lack in number, they may be able to compensate for it in volume. The WHO say a man should have 2 to 3 mils. Some people produce 1.5 mil, but they are giving you 50 million, 100% motility, 80% motility. Or compared to somebody that give you 2 mils of 35 million and 50% motility. Do you get it now? It's a matrix. There are some arithmetic that is done there to establish the fecundity of a man. The total sperm density is the assessment, the report sheet of the man. Do you get it now? So if the sperm is good enough or is borderline and the man produces adequate volume, we are going for conventional IVF. But where the sperm fall below 10, it fall below 5, we are going to the senior brother, the uncle of IVF.
And which are?
Which is
mentioning
ICSI. We're going to get there one day
Yes.
in one of our episodes. Intracytoplasmic sperm injection.
Okay.
That treatment option established that no matter how bad your sperm is, you have the chance of becoming father of as many children as you desire to be.
Okay.
In as much you go to general hospital, they go to the specialist, there will be babies.
What are the other variants?
The variants we have IMSI.
Okay.
You understand me now? This is another uncle to IVF.
We are gradually entering into the complexity of IVF. But gentlemen and ladies, Dr. Abraham Fasasi is here with us, breaking the thing down for you. As we go on, we are talking about your own clinic, Omega Golden Fertility.
Yes.
That when couple presents themselves with this challenge, what are the IVF processes they go through
Yeah,
in your clinic?
we start from the monitoring of the woman
Yeah.
after establishing that the man has good sperm.
Yes.
The woman is on medication and injection, and that might take 10 to 12 to 14 days. Once we realize that the follicles in the ovary of the woman are appreciable in number and size and maturation, the next thing we want to do is to ripen these follicles. I'll give you a simple analogy. You bought a simple plantain from the farm. It's in green and strong. It takes a couple of days for it to turn yellow and become soft that you can fry. So we do the same ripening process to the ovary of the woman, wherein we give a final injection that ripens this follicle and allows the final maturation of the egg inside. So from that point, we take the woman to the theater, and with ultrasound guidance and needle, we bring out everything in these follicles, one after the other. And from these aspirates, the water in these follicles is what we call the aspirate. We give it to the embryologist in the IVF unit, and it begins to sort for the egg inside this fridge. And from there, with the help of the powerful microscopes and all that and incubators, he will be able to take care of the egg like a newborn baby. There's good warmth, there's nutrient, the breast milk is flowing, which is the media and all that. And before you know it, the journey of another life has begun. The sperm of the man is purified, removing the non-sperm constituent from the ejaculate. This pure sperm is assessed again, and you're sure that this volume, this count, is good enough for fertilization of the egg from the woman. The mature eggs are sorted out while the immature ones are discarded. The mature eggs and quality good sperm are made to relate together, either by conventional IVF or by ICSI that I talk about, wherein one egg and one sperm are brought together. The sperm is injected into the center of the egg, and from there we call it forced marriage. Whether you like me or you don't like me, I'll become your husband. That is what we're doing to the egg. And before you know it, come back another 18 to 24 hours, you'll see another life on the way. And we do that for the next 4 or 5 days. By the time we do that for 3, 4, 5 days, I can tell you authoritatively, sometimes we do the two transfer if need arises. And it doesn't mean you're not going to get the same result as someone that had the 5 embryo transfer. I have quite a number of children from the 2 embryo transfer. The 3, we have the 4. A good number of the 5 evidence-based. And that way, once we transfer the embryo into the woman, then there is the big work. We call it the waiting time. This waiting time is a whole lot for the couple. When am I going to do my pregnancy test? Doctor, I'm feeling bloated. My breast is tender. I cannot go to toilet. These are all good telltales that a woman will experience. And exactly 14 days after we put the embryos into the prepared uterus of the woman, we are collecting the woman's blood to check for pregnancy or not. And there and then, hallelujah! Somebody, and you see the couple, some of them break tears. Dog, they will hold you like a lion is holding. They will hold you so firm, like, is this how we come today? To break these jinx. 10 years of marriage, 15 years of marriage, 19, 20. I can tell you that. A woman that married at 20-something years, and then she's doing her first IVF at the age of 56. It's going to look like a miracle. Is it really true that I'm now testing positive? But when you look at her, the telltales of any pregnancy is already all over her. We have 56, we have 59, we have 53, 49, like that. Different class.
But doctor, I still have one challenge.
What is it?
You have broken this thing down, and you are smiling about it because you have gone through so many work. But when you say you are taking a woman into the theater, how do you allay their fears that, theater, when you say theater, it connotes
in IVF,
yes.
IVF, like I said, under 6 to 8 weeks, we are done with everything we need to do. There's no cutting open of a woman in classical IVF procedure. You go with the needle through the vagina of the woman, are you with me, into the ovary, and you are bringing everything out with ultrasound guidance. By the time you are doing that, you are seeing what you are bringing out clearly, and it's being passed to the next department, the next expert, to analyze and let you know that this is this, this is this. That way, you already know where you're going. So the fear, the presentation, the acceptance of the patient is from due counseling of this couple. We show them video of what we do. We have it in the clinic. So the woman is in full preparation and is in full tune with everything you want to do. And she knows that nobody's cutting her with a knife. Nobody's suturing her. And there's no wound she's going to be nurturing. As a matter of fact, she will feel pain for 1 or 2 days after egg collection. And that is the end. The next is to take her babies and go home.
So that's it. In your clinic, you take them through all the things.
Oh yes.
Yes. I know.
We have video. We have a television that presents video of everything. That's to IVF.
In other words, your clinic, they are part of the treatment cycle themselves.
Oh yes, yes.
Nothing is hidden.
They will watch a live video of everything, every step in IVF.
That's fantastic.
Even they will see the picture of embryo transfer, because we will show them. They can use their own phone to snap, so they can keep the record of their baby before the baby was born. Do you get it now? They will see the picture of their baby before the baby is born, and they can keep in their email. They can go to Google and check Google image, embryo day 3, embryo day 4, embryo day 5. What does it look like on Google against their own that they saw in our clinic? Then from there, the integrity, the professionalism, the effort that goes into the investment is laid bare.
Yeah.
So, and it's good for them, where the patients and the professional are on the same page.
Yeah.
It's a see-through practice. You understand me? So they see the embryos from get-go, from the point of transfer. The husband and the wife, the male and female partner, we see they will use their own phone to snap at our clinic, and then we move on.
Doctor, you talked about the embryo. How do you establish or how do you achieve this embryo?
That is the supremacy of Almighty God.
Yeah.
With his position as a God. He gave us the skills to manipulate the egg from the woman and bring the sperm of the man into close proximity in a way they can relate together. It's like when you look at a fried fish and a cat. You ask the cat, how were you able to eat the fish? How was it easy for a dog to pick a bone? Do you get it? But in all, the ground material, the starting material is manufactured by God. The egg is from him, while the sperm is also from him. But once we have access to the two, all right, in our hands, we have the skills, we have the knowledge, we have the equipment at the level of the world today. All right? As far as the world standard practice is concerned, we are not found wanting at any level. I mean, for the health system in Nigeria to accredit you, a lot of certification, thorough check have been done. And for abundance of that, I mean, where you have over 1,360 something babies to your career, I mean, do you get it? It's just like that.
That's wonderful. Over 1,060 something babies.
360 something.
360 something babies. On that note, we round up of this episode. Doc, what's your last line of this episode?
Our viewers across the globe, I'll tell you, if there's anything at all that look like a puzzle, gray areas in fertility, IVF related services, surrogacy and the like, our direct line is on all our social handles, is on our YouTube. Our 24 hours line is available there. You chat us with your questions. Be very clear, explicit in your question. Do voice note to us. Do text message to us. Chat us on WhatsApp. We will respond under 24 hours. There's no aspect, I repeat, of fertility management that we do not have what it takes to throw clear light into the gray areas.
On this note, we have come to the end of this episode. Follow us on all our social media. Visit our website, omegagoldenfertility.com. Our phone numbers are available for you on the screen. You can call us 24/7. Send in your messages, send in your questions, and be specific about your questions. Until we see you on the next episode, thank you very much. I remain your host, Dayo.